Hi, I'm Kavya. I'm a third year Leicester medical student. I'm currently on my Delta laparoscopic surgery placement, and I've been working alongside two other students to form the How to Become a Surgeon teaching series, and today we'll be talking about sutures. So the topics that will be covered today are classification and properties of different suture materials, suture packs, suture size, surgical needles, different suture patterns, and the advantages and disadvantages of these different patterns. So suture materials can be classified into absorbable versus non-absorbable, and then can be further classified whether they are a monofilament suture or a multifilament suture. So examples include monocryl, PDS, vicryl, collagens, surgical steel, ethylon, proline, surgical silk, surgical cotton, and polyester. And some of these may be synthetic, whereas some of them may be natural. And we'll just talk a little bit more about the different properties of the suture materials. So absorbable sutures are broken down by the body. They're commonly used for deep tissues and tissues that heal rapidly. For example, vicryl lasts around 60 days, monocryl around 100 days, and PDS around 200 days. Non-absorbable sutures are used for long-term tissue support. They can be manually removed, and they're used for tissues that heal slowly, such as fascia, tendons, the closure of an abdominal wall, or vascular anastomosis. Synthetic sutures are man-made materials, and they have more predictable properties than their natural counterparts, especially in their loss of their tensile strength and absorption. Natural sutures are made of natural fibres. They're used less frequently nowadays as they can provoke tissue reactions. An example of a natural suture material is surgical silk, which is used to secure surgical drains. Sutures can be monofilament or multifilaments. Monofilaments are single-stranded filaments. They have a lower infection risk, whereas they have a poor knot security and a poor ease of handling. Multifilament sutures are several twisted filaments. They're easier to handle. They have better knot security, however they have a higher infection risk. Next, we'll talk about the suture pack and size. When opening the suture pack, this is what you'll first see. Here we have the manufacturer, the suture name, and the suture material. From this suture material, we find out that this is a monofilament suture. We learn the suture gauge, the suture length, the colour, the batch, the needle shape, which is also seen in a drawing version, the needle code, the reorder number, and the needle material. It's important to choose the appropriate suture size, as the suture diameter directly affects the handling properties and the tensile strength. Therefore, you need to take into account the natural strength of the tissue. The smaller suture diameter reduces tissue damage, inflammation, and patient discomfort. And note that the larger number given to the suture, the smaller the diameter. So a 7x0 suture has a smaller diameter than the 2x0 suture. And next we'll talk about surgical needles. So you can see that we have the needle point, this being the needle body, and then the cord length, and then the swages here. And there are ideal properties of surgical needles. They need to be rigid enough to resist distortion, but flexible enough to bend before breaking. They need to be as slim as possible to minimize trauma, and sharp enough to penetrate the tissue with minimal resistance. And they also need to be stable within a needle holder to allow for accurate placement. And next we'll talk about common suture patterns. This can be divided into interrupted, or running, or continuous. Interrupted sutures mean that every suture has a knot, whereas continuous sutures mean there is only a beginning and an ending knot. The advantage of interrupted sutures is that there is more precise tissue apposition, however it is less efficient to place. The advantage of continuous sutures include that it's more efficient. However, there are some disadvantages such as less control of the wound edges and less knot security on the end knot. Examples of interrupted suture patterns include simple, horizontal mattress, vertical mattress, and cruise ship mattress, which forms an X-shaped pattern. Examples of continuous suture patterns include simple, locking, and subcuticular. Next, we'll talk about advantages and disadvantages of different suture patterns. So the first one that we'll talk about is simple interrupted sutures. So advantages of this include that there is precise tension adjustment, and this is because each suture is tied separately, which helps to achieve good wound apposition. There is secure closure, meaning that if one suture fails, i.e. it becomes broken or it becomes infected, then the rest typically maintain intact. There is minimal tissue ischemia because tension is distributed across multiple individual sutures. This means that there's less chance of cutting off the blood supply compared to continuous sutures. And there is a high versatility as this suture style can be used in different anatomical locations, and it is a typically easier suture style to learn. Disadvantages include that this can be more time consuming as you need to place and tie each suture individually. There is more foreign material due to multiple knots, which results in more suture material on the wound, which can increase the risk of inflammation or infection. There is the potential of railroad track scars if each suture is tied too tightly or spaced too far apart. And there is less even tension distribution. However, it may be controlled individually, it isn't as evenly distributed across the whole wound as you may find with continuous sutures. And there is a bulkier knot burden, as each suture knot adds bulk, which can be uncomfortable in certain areas. And next we'll talk about the advantages of interrupted horizontal mattress sutures. One advantage is that it has excellent wound edge aversion, which promotes better healing and reduces the risk of depressed scars. There's good tension distribution and secure wound closure, and it's better for fragile or delicate skin. Disadvantages include that there is a risk of tissue ischemia if these are tied too tightly. This can impair blood flow at the wound edges, which can lead to necrosis. It's a technically more difficult suture style to learn, especially for beginners. There is more foreign material as mentioned in the simple interrupted sutures. There is the risk of railroad track scarring, and it's a more challenging suture to remove due to the deeper passage and looping of the structure, which can make suture removal a bit harder, especially if there is swelling or tissue overgrowth. The next type of interrupted suture patterns that we'll talk about are interrupted vertical mattress sutures. Advantages of this include that there's excellent wound edge aversion, as this technique pulls the wound's edges outwards and upwards, which helps to prevent the wound from healing with an inward rolling. This reduces scarring and promotes better cosmetic outcome. There's good tension distribution, as both deep and superficial tissue layers are incorporated. This relieves stress from the superficial layer. There's good strong wound closure, which makes it suitable for high tension areas such as joints or thick skin. And there is a reduced risk of wound adhesions. Disadvantages of this include the risk of tissue ischemia if sutures are tied too tightly. It's a more technically difficult suture style to learn, and there may be more pain and bulk associated with this. There is a risk of railroad track scarring, and it's harder to remove due to the deeper placement. Advantages of interrupted cruise ship mattress sutures include a secure wound closure, good tension distribution, a reduced risk of ischemia, better cosmetic outcome. Disadvantages include that it is technically difficult to perform, there is a risk of scarring, and it's limited to areas of moderate tension. It may create surface bulk, and it may trap fluid inside, which increases the risk of infection. And next we'll talk about the advantages of continuous simple sutures. Advantages of this include increased speed. It's much faster to place an interrupted sutures, making it ideal for longer wounds. There's even tension distribution along the entire wound, which helps in even healing and allows for good cosmetic outcomes. There is a reduced foreign materials, as there's only one knot at the start and one knot at the end, which reduces the risk of infection, and there is good cosmetic outcome. Disadvantages include the risk of wound dehiscence. If one suture breaks or loosens at any point, this may mean that the entire wound may open, and as the closure depends on a single thread. There is poor individual tension control, and it's not ideal for high tension areas, and there is a potential for tissue strangulation if the suture is placed too tightly. And then we'll talk about continuous locking sutures. It's more secure than simple continuous sutures, as each lock pass adds friction and security, so even if one section loosens, the whole suture line is less likely to fail. It's good for long wounds, and there is good hemostasis, as there is continuous tension and compression of the wound edges, which can help control bleeding from small vessels. There is better edge apposition, and it's good for longer wounds. Disadvantages include that there is a risk of tissue ischemia, as added tension from the locking loops can compress tissue too tightly, which can impair blood flow and increase the risk of necrosis. There is a bit more foreign material, which can increase inflammation and infection risk. And then it's difficult to adjust after placement, as once locked, the tension adjustments are harder to make without removing or redoing parts of the sutures. It can be time consuming and a bit more difficult to remove. And finally, just a summary of what we've talked about. So sutures can be classified based on their properties. This could be absorbable versus non-absorbable, synthetic versus natural, monofilament versus multifilament. Suture packs can give you information about the suture material, the gauge, the length, the colour, and the needle shape and the length of the needle. Surgical needles, the most important parts to know are the needle point, needle body, the diameter, and the swage. And then the most important ideal properties that are needed to know is that the needle has to be rigid yet flexible, slim, sharp, and stable. And then lastly, suture patterns. These can be divided into interrupted or continuous. Examples of interrupted include simple, horizontal mattress, vertical mattress, and cruciate mattress. Whereas examples of continuous include simple, locking, and subcuticular. And I hope that what we've talked through today has been useful, and thank you for listening.